You know that feeling? Swollen, heavy, aching legs? A lot of us have been there. And while sometimes it's just a sign of a long day, it can also be a hint that your body's really intricate drainage system isn't quite working right. Today, we're going to dive into two of the most common and honestly often confused reasons why this happens. We'll break down what they are and what makes them so different.
I mean, it's a pretty common story, right? That heavy feeling after you've been on your feet all day, or maybe you've noticed those bulging veins starting to pop up. Well, the answer to why is buried deep inside our body's amazing return system, this incredible network that's in a constant fight with gravity to get all that fluid back up to the heart. So let's take a closer look at how those internal pipelines are supposed to work.
All right, first up, let's get a handle on the plumbing. Your limbs actually have two return systems running side by side. You've got one for blood, that's the venous system, and another for all the other fluid, which is the lymphatic system. Just think of them as the body's essential drainage and recycling crew.
So the venous system, it's this huge network of vessels with one really tough job. Carry blood from the tips of your toes all the way back up to your heart. I mean, that's a serious uphill battle against gravity. And to win that fight, it has this brilliant design of tiny one-way valves that keep the blood from flowing backward.
Now, this system has a couple of different kinds of roads. The superficial veins, think of these as the smaller, local routes. They're right there between your skin and that tough layer of connective tissue around our muscles. These are the veins you can actually see sometimes.
And if the superficial veins are the local roads, then the deep veins are the superhighways. These guys run right alongside major arteries, deep inside the muscle, and they are responsible for doing the vast majority of the work, getting that blood back to the heart. This is the real heavy lifting part of the whole operation.
So, what happens when this whole system starts to break down? Well, that brings us to chronic venous disease. The best way to think about it is like a massive traffic jam in your veins. Those little one-way valves that are supposed to keep blood moving up, they start to fail. And when they do, blood starts to pool, and the pressure just builds and builds.
And the most obvious sign of this venous traffic jam? Varicose veins. Now, there's a specific definition for these. They aren't just any old vein you can see. They have to be dilated, bulging, and twisted. It's all that pressure from the pooling blood that causes that classic dull ache or that feeling of heaviness.
You know, not all varicose veins are created equal. You've got primary ones, which are caused by some kind of weakness in the vein walls or the valves themselves. Sometimes it's just down to genetics. But then you have secondary varicose veins, and these are a symptom of a much bigger issue, like a blockage or failure in those deep vein highways. That forces extra blood into the superficial local roads, and boom, they swell up.
And believe me, this is not some rare condition. We're talking about an estimated 30% of women in the United States having varicose veins. For men, it's about half that, around 15%. That just goes to show you how incredibly common this really is.
You can actually track the progression of venous disease through different stages. It often kicks off with simple spider veins. Then it can move to full-on varicose veins, and then to edema, which is that noticeable swelling. And here's the really crucial takeaway. If you don't manage it, that constant pressure can eventually cause serious skin changes and even painful ulcers that are a real nightmare to heal.
Okay, let's totally switch gears now and talk about that second system. This problem has nothing to do with blood, it's all about lymph. That's the fluid that bathes all of our cells. The condition is called lymphedema, and it happens when the body's other drainage network, the lymphatic system, gets blocked up.
So lymphedema, it's basically a plumbing backup of a totally different kind. The lymphatic system's job is to clear out waste and extra fluid from our tissues. But when its vessels get damaged or blocked, all that protein-rich fluid has nowhere to go. It just piles up, and that leads to some pretty significant swelling.
And just like with varicose veins, there are two main flavors here. Primary lymphedema is pretty rare. It's caused by a congenital defect. That just means someone is born with a lymphatic system that didn't quite form right. Maybe some vessels are missing or underdeveloped. But secondary lymphedema is way more common, and that's when a perfectly normal system gets damaged later in life.
So what's causing all that damage? Well, around the world, the number one cause is a parasitic infection called filariasis, which you get from mosquitoes. But here in developed countries, the most common reason is actually cancer treatment. Think about it. When lymph nodes are removed or damaged by surgery or radiation, it can totally disrupt the entire drainage pathway for an arm or a leg.
Okay, so we've got two different conditions, and they both cause leg swelling. One's a blood backup, the other's a fluid backup. So how in the world can you tell them apart? The signs can be a little subtle, but there are some really key differences to look out for.
This is where we get into the real clinical detective work. With venous insufficiency, the swelling is usually soft and what we call pitting. If you press your finger on it, it leaves a little indent. You'll also see that brownish skin discoloration around the ankles a lot. But with lymphedema, the swelling usually starts way down in the foot and works its way up the leg. And while it might be pitting at first, over time the tissue gets hard, almost firm like wood. The classic test is called stemmer sign. If you literally can't pinch the skin at the base of the second toe, that is a very, very strong indicator of lymphedema.
All right, so the thing is, neither of these conditions can usually be cured, but they absolutely can be managed, and managed effectively. The whole goal is to get the symptoms under control, bring down the swelling, and stop the problem from getting any worse. Let's take a look at the toolkit.
For both of these conditions, but especially for venous insufficiency, the foundation of treatment is all about the simple stuff. Seriously, simple things make a huge difference. Elevating your legs uses gravity to help you out. Exercise, especially things like calf raises, gets that calf muscle pump going, which helps squeeze the veins and push blood up. And compression. Compression is king.
And really, it's impossible to overstate just how important compression is. This isn't just a friendly tip, it is the absolute standard of care for advanced cases. Those special graded compression stockings provide outside pressure to support the vessels, stop fluid from pooling, and they can even help heal skin changes and ulcers. It's a game changer.
Now, when those basic measures just aren't cutting it, the treatment paths really start to split. For venous disease, the procedures focus on closing off the bad veins, using things like heat or chemicals to shut them down. But for lymphedema, the focus is all about managing the fluid and preventing complications. We're talking about specialized massage to manually move the fluid and incredibly careful skin care because a swollen limb is a huge target for infections.
So let's wrap this all up. We've got two conditions that can look pretty similar on the surface, but they have totally different root causes. Venous insufficiency is a blood circulation problem because of failing valves. Lymphedema is a lymphatic fluid problem because of blocked drainage pipes. And knowing these key differences, well, it's absolutely essential for getting the right diagnosis and, more importantly, the right plan to manage it.
I mean, when you stop and think about it, your body's circulatory and lymphatic systems are just an incredible marvel of engineering, working nonstop every single second. Understanding how they work really helps us appreciate just how complex and amazingly resilient our bodies truly are. Thanks so much for joining me for this explainer, and as always, stay curious.